Well, Planetree really was the epicenter of patient-centered care.
Patient-centered care is really the way we deliver care and really make it special to each individual patient because we're all unique and different.
The origins of the concept, or the word Planetree, really, Planetree is the common sycamore tree. And supposedly it's the tree under which Hippocrates taught, surrounded by flowers and beauty and art and poetry. The environment that the person is in influences how DNA is expressed. So gene regulation is actually influenced by behavior and environment.
It's knowing that we can do almost anything for the patient experience to really make it unique and special and really personalize it for each patient that we care for, regardless of where they are in our organization.
The simple origins of Planetree are kindness, respect for the patient, and combine that with good medical care, you have something that not only offers the best of modern medicine, but the nurturing aspect.
We know for a fact that when patients get the rest that they need, that helps in the healing process. So hospitals are noisy places. You might have monitors beeping, you have folks coming in and out of the room. So we have a concerted effort in place to really minimize the noise.
We've reached the highest level of Planetree designation, something called distinction. There are only a handful of the 300 plus hospitals that have reached that level. When the new hospital was designed, I personally was very touched by the fact that it was built in a way that incorporated Planetree concepts.
There's so many different Planetree elements. Each floor will have a very distinct look. The artwork is very unique to this area. You may be on a floor that's all ocean and sand and seashells. You may be on another floor that shows the very New England look of stone walls and stone bridges.
We have an arts committee, a signage committee, that really spent a huge amount of time figuring out what should be on each floor.
The Grand Concourse will be very open and inviting. We have a wonderful opportunity with a new chapel, which will be right on the main floor with a beautiful glass that welcomes folks of every denomination. On the patient floors, what's different is the spaces that we have for family members. Clearly they'll have more room to visit their loved ones, and they'll actually be able to spend the night with them because we'll have sofas that pull out to beds. But the waiting areas, when they need to have a family meeting, there are private areas, quiet rooms. There's food centers, nourishment centers where families can convene and be together. It's just such a difference from where we are now.
We know for sure that if you do step in to the hospital, you're going to be anxious. And so we're designing programs to relieve that anxiety. You should feel that you've not only been well taken care of medically, but emotionally.
All of the programs and best practices that we have in place, you're not going to find at every hospital. You're not going to find necessarily a Tuck Me In program or an At Your Request or healing modalities such as integrative medicine at every organization. For us, we feel that we really have been pioneers. We've been on this journey for over 12 years and continue to look for new opportunities to really make the patient experience an outstanding one.
We're melding the art of nurturing with the science of medicine.